This is Craving More, a CrossFit Crave podcast where we find motivation through obstacles, resistance, and everyday life with your co-hosts, Matt and CJ. Today on the podcast, we interview Dr. Aaron Kuhn. We talk about the relationship between mental and physical health. We also talk about the community that CrossFit has allowed us to create here at CrossFit Crave. Please enjoy.
Okay, CJ, welcome back.
Matt, thanks, Matt.
How are you?
I'm good. How are you?
Good. We got a great special guest today.
Fantastic special guest.
Dr. Aaron Kuhn. Aaron, welcome to the podcast.
Yeah, welcome to the show.
Thanks for having me.
Yeah, we're excited.
I just called it a show. Is it a show?
It is a show. I mean, kind of. We have followers.
I felt too official when I said it.
Okay.
I told my daughter I was coming here today, and she said, "You're going to be famous." So
Boom. There we go. Maybe it's a show.
it's all a show.
There you go. When we started this, we had a joke between the two of us, like the two dumbest guys you know starting a podcast.
Yeah.
And we're like, we'll have our followers, our parents and our spouses. And
That's it.
No, all four of them.
All four of them.
Add my daughter in on that.
There you go. All five now. Cool. Well, hey, before we get started, I wanted to read a note that we got today. Speaking about our followers, we have actual people that listen to our podcast.
Yeah.
And we're doing
Outside the
good things
family.
here. Yeah, exactly. So, this individual sent me this note this morning. Just wanted to tell you I listened to Dr. Tyler's podcast, and the message really hit home. So many things I wish I could go back and redo, such as my squat form. Anyways, seeing Dr. Tyler today, ready to make progress. Well done on the podcast, and well done on what you're doing there at Crave, both physical fitness and the mental mindset. Keep killing it. I thought that was kind of cool.
That's huge, yeah.
Right? One of the goals with what we're doing here with CrossFit Crave and our future goal is not only attacking the physical part of your life, the physical exercise, we also want to look at what other factors play into your overall health and wellness, your well-being, so to speak, right? So we've done a lot with Dr. Tyler, right? Chiropractic, brought him in. How do you move? Why do you move? He's going to start to have hours here to help people with that. We've got Maria Zenz, who's our physical therapist.
Maria Zenz.
Yeah, she has hours here. She sees patients already. And we just recently brought in Dr. Libby Wilson, who was originally from Salina, but now she's seeing patients here, right? From a functional medicine perspective. So one of the things that CJ and I talk about is like, hey, there's a mental side of our life, right? That maybe we don't necessarily think of physical fitness would tie into. And I thought to myself, I know my best friend growing up, because Mr. Kuhn here and I grew up together. I'm like, I bet he's got some background that can help us from that mental perspective. So that's why I invited you on the podcast, Aaron, and I appreciate you being on. Why don't you take us through kind of your background and what if you're a doctorate, you have your doctorate, and what that doctorate is based on, and then we can dive into kind of the tie between mental health and physical health.
Yeah. I have a PhD in general psychology and dual license to treat mental health as well as addiction. So I'm a licensed addictions therapist as well as a licensed mental health therapist. I've been practicing in the field of psychology for over 20 years. I like to do it all. Play therapy as young as 4 years old. I do that. Relationship counseling, family counseling, marriage counseling. Treat addictions, depression, anxiety. I practice here at a Christian private practice called Counseling and Consulting Services here in Salina. And that's pretty much my career in a nutshell.
So Aaron's being really, really humble at this point in time. He was probably one of the best athletes to graduate from Parkway High School.
I don't know about that.
He was pretty good. He was pretty good. So
My mental health probably got in the way, or I maybe could have been better. Therefore, I went into the field of psychology
Yeah,
to try
why did you go into
I was my
psychology?
first client.
That's right. That speaks to me first. Well, that's exactly what Dr. Wilson said. Libby's like, here's a doctor of family practice for 15 years, 2,600 patients. She's a CrossFitter. She's a CrossFit coach. And at 40 years old, she's now 45, my age, our age. At 40 years old, she was like, I feel terrible.
Yeah.
Like, I don't understand. I'm a doctor. I work long hours. I get that. I'm physically in great shape. But I just, at the end of the day, like, I am drained.
Yeah.
So she went on a mission to fix herself.
Yeah.
And found out that what she learned in her 11 years of getting her doctorate was great, but it wasn't really at the foundation of what causes human health and how to fix human health.
Yeah.
Yeah,
So
she said,
spent the last, go ahead.
right, well, she said she was great at fixing sick people,
Yeah.
but people like her who just didn't feel good, they may have passed all like the medical tests and stuff, but like to consider you like healthy, but she didn't feel good.
Yeah.
So the medical side was really good at fixing like sick people, but not like maybe normal people that just don't feel right.
Yeah. Yeah.
So she dug into that.
Yeah.
And there's, gut health, and there's
Adrenal
adrenal health, and all of that. That she opened up this world to
Yeah.
her, and now she's left her practice of 15 years and 2,600 patients, and said, "Hey, I'm going to do
Yeah.
functional medicine. I'm going to partner with groups like CrossFit, Crave here, and work with athletes that want to physically be better,
Yeah.
not just here with a heavier deadlift, but out there going to Walmart.
Yeah.
They want to feel better.
Yeah.
Right? And there's a mental side to that too.
Yeah. Yeah. You talk about the gut, the brain and gut are connected. The brain, it is the engine for everything, basically. And it's so important to manage past traumas, genetic environmental link, what you experience and your genetic predispositions for certain things. If left without insight, we're trapped.
Yeah.
And some of us with psychological issues don't know where to go, how to get help, what's going on. And a lot of times they think they're going crazy when in reality millions of people suffer from the same thing. For example, 300 million people worldwide struggle with depression. And when you're experiencing depression and you don't understand that other people feel that way, you feel like you're the only one on the earth. Isolation, yeah. So mental health is huge. I love what you guys do here at CrossFit because it's about community. If you look at the importance of community mental health wise, I mean, you look at it even from the Judeo-Christian perspective. The Bible talks about it wasn't good for man to be alone, so he made Eve out of his own flesh, out of Adam's own flesh. So we're not meant to be alone. Isolation is no good. And you even look at the brain. There's a chemical called dopamine. You guys have probably heard of it. It's in the reward centers of the brain. And just being around people, connecting and having community increases dopamine levels in the brain. And that can combat anxiety, can combat depression. Just so powerful. Community is so powerful in regards to brain health.
And I think that depression part of it, that can come and go, right? And maybe I'm wrong, but it's not like you were born with depression. You're just a depressive person.
Yeah.
I've witnessed it myself internally,
Yeah.
having those depression waves of going through very traumatic things, and then
Yeah.
you're depressed, and just coming back from shoulder surgery.
Yeah.
And if you take something away, like you take the physical workout away
Yeah.
that this shoulder surgery gave for me, CrossFit,
Yeah.
man, it was, the first couple of weeks, it was okay. I'm like, I'll be back. And then week 4, and then week 5, and then week 6, it was a depressive, still is for me, because I know what I had, and I don't have that anymore.
Yeah.
So there's that depression that creeps in. So it's not, it can come and go, right? Or,
Yeah, we use what's called a DSM-5, a Diagnostic and Statistical Manual. You know, it's boring to read, but if you look at depression, there's to meet criteria. You know, Matt, you talked about a situational thing. You know, you can't work out, you don't experience the community like you did. Right, you don't get that dopamine rush. So yours is situational. So we would call that an adjustment type of issue, adjustment disorder with depressed mood, where you're still experiencing depressed mood, and it's situational. You know, and then you have other depression that is long lasting, and you know, people can experience thoughts of death and suicide, and just their hopelessness in life is so intense that and it could be lifelong. So that is where it's more chronic depression, severe depression, and it can even get untreated. It can even, you know, lead to psychosis and all kinds of stuff.
Right.
So yeah, there's situational, there's chronic, and some of that is more just flat out genetics and lifestyle can trigger that chronic depression.
So I think that's a big thing with the situational, because I feel like a lot of that, like situational stuff, because it's not long lasting, I feel like almost everyone experiences that.
Yeah.
And I feel like you almost need that sometimes. Maybe not need it, but it really helps you enjoy like the more positive aspects of
Yeah.
life. Whereas if someone has like the chronic depression where they're just like, you feel like this all the time, I think that can really make you like actually feel alone. Like you don't know what the highs felt like anymore. You don't.
Yeah.
So I think that
Depression almost becomes normal for the
Right.
person that's chronically depressed. Situational, and it all depends. You talk about people can come out of that. Well, everybody's different. Everybody adjusts to stressors and situational things different. Some of us are more resilient than others. Some of us have trauma. And then when trauma starts stacking up on us, then we have more trouble being resilient and coming out of that. And sometimes we need a loved one to come by and, you know, sometimes take us by the hand and help us get out of that. But when you talk about situational, being resilient, and let's say it's situational and you have years of trauma, it's harder to maneuver because the brain actually rewires with trauma. There's something called the frontal lobes that help us regulate emotion and transition in life. And with trauma, our frontal lobes are prevented from developing like they need to. And because of the hypervigilance associated with trauma, then we're not able to regulate our emotions real well, and then that lack of frontal lobe development hinders us from being resilient in the moment.
Right.
So it's not always easy for someone depressed to get up and do things they know is good for them.
That's
Yeah. And it kind of goes along with, you know, you talk about how do you get someone who's depressed off the couch, out of bed, into exercise and community, because they know and we know it's good for them. I mean, almost everybody knows that exercise is good for them.
Right.
Almost everybody knows they should eat right, and it makes them feel better. Almost everybody knows that isolation's no good. And the thing of it is, when we tell them that, it insults their intelligence and they're less likely to come.
Yeah.
So the question always is, how do you get individuals who are down, depressed, anxious to come in and do what's good for them? Well, I can tell you what not to do that most people do. Doctors, all of us do it. We write them. It's called the writing reflex, R-I-G-H-T. It's like, for example, someone with diabetes who's overweight. What do we tell them? Stop eating sugary foods, reduce your carbohydrates.
Yeah.
So a doctor would tell somebody that.
And we lead with, you're killing yourself.
You're right,
You're gonna
yes,
end up with
yeah,
heart
yeah,
disease,
yeah.
liver disease,
Yes,
or
yeah.
diabetes.
Yeah. So we have someone with depression, trauma, who doesn't regulate real well and have good impulse control because of their impulse control issue from the frontal lobe issue. And now we start telling them the things they already know they should do, and they're already shaming themselves for it. So we write them. So they leave the doctor's office ashamed of themselves, less likely to come to community and exercise. And a lot of people, we we preach, lecture, nag, and reason at individuals that need it. They know they need it, but we just do it all the wrong way.
Yeah.
So you're almost leading with a negative thought, like you said, like you're killing yourself to create even a more like a compounded negative effect.
Yes. Yeah.
Exactly. And it speaks to what Dr. Libby was talking about from somebody comes in with type 2 diabetes, right? And they're very sedentary, and I'm going to throw medication at them because I got to try to keep them well. But there's a root to that. There's a problem for that, right? And what she wants to do is say, okay, listen, let's temporarily medicate that because, it's serious. We want to save your life. But let's fix the long term. Is there a thyroid issue?
Yeah.
If there is, then there's a reason for that thyroid issue. So let's dive to the root of that.
If we look further at the root, in my world, the psychological world, anybody who may be chronically obese with diabetes, I pretty much know that there's a trauma story in there somewhere, and they're probably self-medicating with food.
Yeah.
Unless, you talk about food, just like exercise, what does food do when you eat these yummy, sugary foods? It releases dopamine in your brain.
Yeah.
So, and it's easier than coming in and to maybe CrossFit.
That's right.
Where
It's
you...
cheaper than healthy food.
Yeah. And you also when you look at trauma and, let's say, trauma, food addiction, they're self-medicating, and they're body shaming, and they've been traumatized, there's something called the in-group and out-group, okay? The in-group and out-group, we need to understand, because anybody who has a trauma story who may have the same issue is in the in-group, okay? Mm-hmm. They may perceive everybody here working out is in the out-group because they haven't been traumatized, they're all in shape, so I don't fit in. So unfortunately, that increases isolation.
Yeah.
So they kind of create a group within themselves.
Yeah, and
isolation though.
Yes, and that I love what Sebastian Junger says about that. He says we all have a tribal mentality. Mm-hmm. We all want a tribe. And that's what I love about working out and working out with groups, is it gives us that tribal feeling. There's a sense of community and the dopamine and all the wonderful things. But if you're in the out group, or in the out group, and your in group is a bunch of people who are depressed and traumatized, and you can only relate to people with trauma, you're not going to come in and do this. So the question is, I get a lot, how do we get these people motivated to go against that and invite people that's perceived to be in the out group in the in group?
Get in.
To change that method of thought.
Right, yeah.
I think we kind of do that with Expanding Horizons.
We do. There's a couple of different ways, I think. Expanding Horizons, Couch to CrossFit. It's interesting that you talk about that. We got into a conversation with another gentleman about the likeness between the community that we've developed here at CrossFit and maybe the community that you would develop at a church. And the likeness is not that we're pulling the Bible out and we're showing what Christ has done for us, but he's like, listen, how many times does somebody, a complete stranger off the street, just walk in the door and say, what's this place? Let's check it out. Yeah. Versus somebody inviting, hey, man, I worked out at this place called CrossFit. It's got a great community. Come try it just once.
Yeah.
Think about how you go to a church. Do you just pick 5 random churches when you're looking for a church in a new community and just go in? Maybe.
Yeah.
But it's more likely somebody says, hey,
yeah,
I've got this great church. It's got a great atmosphere. And then all of a sudden you find yourself going to the same sermon.
Yeah.
Sitting in the same pew because you've developed that in-group of community around you.
Right, yeah.
You know? And so how do we effectively take the people that are in the in-group, right, that are sedentary, that have those depressional mindset.
Yeah, and you're in the out group.
Yeah, and you're in the out group.
Yeah.
And how do you bridge that?
Yeah, that's a great question. And my answer to that is motivational interviewing. And I'll tell you a little bit about that. It's wonderful, but you got people that are highly motivated, and you can tell them exactly what to do. Okay.
Yeah.
And you had people like that want to get better.
Yeah.
And hey, you got to do this, and this. They're on it. Okay. Mm-hmm. Someone that is, years of trauma, just they're in that rut. Now we got to look at motivational interviewing. And motivational interviewing is awesome because it's relationship oriented, and it's about sitting down with them, entering their world, you're proximal to them, you're parallel with them on the same level, and you're just interested in their life. And you do that simply by asking open-ended questions. You're like, hey, tell me about things. What's up with your life right now? And then ask additional open-ended questions based on what they share. And if that's done with integrity and genuineness, over time they'll let you in, and you'll be in the in group. A real cool story. It's in the book. The Body Keeps the Score. It's about trauma survivors, PTSD. The in group and out group is mentioned in that as well. There's a story where the therapist was sitting with a bunch of PTSD veterans, and over several months of meeting with them, they finally gave him a present that symbolized that he was in the in group. And it took months for that to happen.
Yeah.
And the therapist was flattered. It also saddened in the aspect of he thought how many wives were in the out group.
Yeah.
How many people in this society and family members were in the out group, and he had to work that hard to get in. And how he did that was ask open-ended questions, show that he cared. He had genuineness about him, and it worked. He penetrated through. And that's what we have to do with individuals we see a need in the community. You guys are doing some of that with the juvenile court system. And it takes some self-disclosure of our own stories. We all got one. Matt, you got an amazing story. We let them in a little bit in our story, and all of a sudden we start getting this reciprocal communication. And the cool thing about reciprocal communication is it targets the reward centers of the brain. And we start getting that.
I find commonality now with the individual.
Right. And our brain starts to feel better because we're getting those natural dopamine effects from, how God intended to be, to have natural highs from experiencing community.
Yeah.
So I get how, like a therapist or psychologist, they're like a business that's like how CrossFit's talking to like the judiciary court or whatever, how that conversation could be started. But how do you reach out and start that motivational interviewing with someone?
Yeah.
So is there, and that's a great question, is there a link like we do with our Couch to CrossFit? So we invite people to come in. We call it Couch to CrossFit.
Yeah.
So if you've never done anything, we want you to come in, and that very first day, it's just an interview. We set with a group of people, and we talk to them. They don't work out. Right. We do simple things like, listen, that we're going to ask you to pick that up off the floor.
Yeah.
Right. And we put a marker, literally a dry erase marker on the floor. Hey, can you pick that up for us? Somebody picks it up, and I'm like, great, thank you. You've just deadlifted. They kind of like, I don't understand.
Yeah.
Anytime you pick something off the floor, that's a movement. We call that a deadlift. We're going to show you how to do that the correct way.
Yeah.
But today, we're only going to ask you to do that one thing one time.
Yeah.
That's where you're at.
Mhm.
And the person next to you may be able to do that twice.
Yeah.
Great. So tomorrow we may have you do that 2 more times.
Yeah.
And that's where you don't have to come in here and we'll meet you where you're at.
Yeah.
You don't have to meet anyone else where they're at.
Yeah.
And we try to break those down, but it's how do you get them to come into Couch to CrossFit?
Yeah.
in the beginning? That's where we're.
Yeah. Well, you talk about the theory of proximity. Okay. I hope you guys don't mind me sharing, but the Bible talks about Christ came to serve, not to be served. Okay, so we're called to serve. Now we're one person, but the theory of proximity says that we're going to have people proximal to us. And how do I serve the people I'm proximal to? And that is whoever I'm proximal to. I ask open-ended questions, like how and what questions. For example, if we're proximal to someone and they experience something and we say, hey, if you don't mind me asking, what was that like for you? And then when they say it was like this, and wow, what are you going to do about that? What's your next step? And what we're doing when we do that is the what and how questions help us to see whether the person has what we call problem identification. Like my daughter, for example, she had a report card. And she wanted to do better on a couple classes, so I did some motivational interviewing. I said, how do you feel about your scores? I'd like to do a little bit better, Dad. What do you think? What do you think you'll do about that? Oh, I think I want to study more. So what I'm doing in that particular situation, even with a 10-year-old, I'm seeing if she has problem identification. I'm seeing if she understands consequences of the issue.
Yep.
I'm then helping her identify strategy for change. And then once I get to strategy for change, I'm going to see how confident they are. So I might say, how confident are you that you can do this? And she might say, well, not very confident. I'm going to need your help. Okay, now I got another open-ended question. What can I do to help you? Well, what would happen if you read with me, Dad? I'd highly enjoy that. That's with a 10-year-old. Now, you let's bring an adult that may be sedentary with some depression and stacked trauma, and we know they would benefit from the community of CrossFit, and we're proximal to them. We see what's proximal, we know something about them, and we start generating some what and how questions. And after that, you start saying, hey, what do you think about CrossFit? Well, you guys are all in shape. You all have 8-packs.
That's right. Yeah, exactly.
And so we're seeing that she has a stereotype.
Yeah.
And
Out in the
yeah, right, yeah. So we know that she's going to struggle. And you might have another open-ended question. Hey, what gives you that impression that we all have 8-packs? So I'll show you mine. Mine's not quite there.
Yeah.
And she might say, well, I went to a gym before and I was body shamed right there in the gym. So she's opening up her trauma to you. And then what do? We validate. Beautiful thing about validation is just saying, paraphrasing back, wow, that must have really hurt you. And guess what validation does to the brain? It soothes an overactive amygdala. And then the amygdala in the brain is where anger and anxiety come from. So just by validating her experience, wow, you were shamed, you felt that, and you ran out of there. Yeah, I didn't know what else to do. I promised myself I'd never go back. And we were now getting in the in-group. And then you can follow that up with, she might say, it's obvious I need to work out. I mean, I know it's the healthy thing to do. Again, we don't assault their intelligence by telling them they should be here.
Right. Mm-hmm.
And then you say, what's keeping you from that now? Well, that story, what are you considering? What might happen if you don't find something that works for you? Well, I probably will die.
Yeah.
So what are you going to do about that? How are you going to manage that? Yeah. And then she starts identifying maybe some strategy for change. And then if it feels right and you've made that connection and you've experienced that reciprocal communication, you might say, what do you think about CrossFit with me? I'll protect you.
Yeah, I'll be there with you.
Yeah, right. And now you're playing that community, that support.
Right.
And then you might say, how confident are you that you can do that with my help, with me being there to support you? I'm really confident. You're cool to hang out with. I feel really confident. And then now we've got them.
Yeah. Mm-hmm. Yeah.
Through open-ended question, validation to calm that overactive amygdala. And that's a community. You begin to build a community that way. You build a relationship that way. Yeah. And it's great for mental health, and it's just amazing.
I think to go with that, I was listening to a podcast earlier this week that talked about, they called it the 5 hours of bringing people into something that's out of their norm, like a CrossFit facility. And they talked about the relationship part of that. One of the R's is the relationship part. And the way this individual handled when a client called and said, hey, I want to come check out your CrossFit location, the first thing they go to, are they like, hey, what's your background? Hey, don't have any CrossFit, I've never done it. They go like, great, we'd love to have you. You know what? Why don't you bring a friend along?
Mm-hmm.
It's always better with your friend there, right? And I'm sure you know somebody that maybe wants to try it out. We'll let them both take the first class for free. And all of a sudden, now this individual that was on the call was like, oh, well, yeah. I got my aunt, my uncle, my brother, my friend.
Yeah,
I'll drag him along because it's that relational part.
Yeah.
That somebody that's familiar is now going to come with me to kind of hold my hand into that step of the unknown.
Yeah, I'll bring a part of my tribe to broaden my tribe, maybe. Yeah.
Yeah, because now I feel a little bit protected.
Yeah.
Right?
Yeah.
Then I'm not isolated. I'm not singled out.
And you talk about millions of people struggle with anxiety. And anxiety is uncomfortable. We think it's dangerous and we run away from it. Okay? So if you're having heart palpitations and you're experiencing what we call derealization, like you're outside your body or just feeling detached from your body, and you're having a hard time breathing because you're afraid to come in and with these people who are fit, and we run away from that to not feel that way. So we perceive anxiety as dangerous. So in that situation, you're inviting a friend or family member to come with you. That automatically appeases the anxiety. Some. Now they're going to have to learn to do some work, to regulate even more. But just having somebody with you to face maybe a feared stimulus like going in front of people, working out in front of people, is a good technique to help flood anxiety. Running toward anxiety is not an easy thing because we let it bully us because we think it's dangerous because it makes us feel like we're having a heart attack or when in reality it's not dangerous.
Yeah, for sure. I know one of the things we talked about, the juvenile kids, one of the things we've seen, just in the 2 years that we've worked with him is there's one particular individual, a young man, I mean, he's 17, he was 15 when he started. But when he first came in, he wouldn't say a word.
Yeah.
He was in the corner and he would put his head down and you'd go to talk to him and he would acknowledge you, but he would look away.
Yeah.
Or he would walk away because he just didn't want in that situation, right? And then gradually, after you build a little confidence, you kind of like, okay, I get, like, he's not that person. I can't get in front of him all the time.
Yeah.
Because he's really going to. So you're step by step. And he comes in, hey, how's it going?
Yeah.
And little by little. And now, like, he is the light
Yeah.
of the room.
Yeah.
Like, he comes into this environment and it's just
Yeah.
on.
Yeah.
He's like, hey, my people are here.
Yeah. Yeah.
You know what I mean?
Yeah.
So
Yeah.
from a mental change,
Yes.
you could truly see that. And I
Yeah.
know the probation officers are like, it's tremendous
Yeah.
to see the stimulus
Yeah.
that's created
Yeah.
for just that one individual.
Yeah, yeah. And you're talking about going slow with him. That's a progressive exposure to people. When you got social anxiety, you want to do that progressively. And that's what you gave him a tribe or an environment to progressively expose him to socialization, which was an anxiety-provoking thing to where now he's flourishing. That's what we're talking about. You guys don't realize you're doing it, but you're doing mental health therapy right there. It's what we call in the psychology realm in vivo desensitization, which is real-life desensitization of the anxiety because you're flooded and immersed in the situation. And you're doing it progressively in a safe way, and there's a success story. You hang your hat on things like that.
Right.
Yeah, it even plays into, we have a Iron Wills, we have a special needs Olympic powerlifting team. Coach Mike Wolf helps us with that. And there's one individual, Denzel, he's an adult, that was he was almost nonverbal, even at home. Very strong, but almost nonverbal to a point. Started coming to the powerlifting group. And we've only worked with those adults maybe 8 months. And the stories out of Grandma and Grandpa that bring him are phenomenal. They're like, listen, he talks to us. He carries on conversations. They're like, we had no idea the depth of his intellect because he was so to himself.
Yeah, he's just quiet.
He sees Coach Mike as, this is my best friend.
Yeah.
And I'm moving heavy weight.
Yeah.
Right? He's moving 300 pounds, right? And he loves it.
Yeah.
And all of a sudden, something inside clicked.
Yeah.
I want to communicate.
Yeah.
And his grandparents are beside themselves. They're like, he carries on conversations.
Yeah. You bring up a whole another thing that's really cool. You take an adult individual with developmental issues, say autism with developmental delays. A lot of people don't know this, but they have sensory issues. Some of them are what we call hyposensitive and hypersensitive. The hyposensitive, they want touch, they want movement, and they want weight. So when you got a kid that maybe is an adult who's autistic, who has sensory issues, and they desire that hyposensitivity, they desire weight pushing, feeling that weight, that gives them a sensory need and accommodates their sensory needs so they get healthier. And it's unbelievable. So then you got others who are hypersensitive where they don't want any weight on them at all. They don't like touch, and but you have a kid with developmental issues that desires that. Weight training's perfect as long as they can do it in a safe way and they got the coaching for it.
Yeah.
And and we're even seeing they can also promote more communication when maybe they lacked that in the past. So you bring up a whole other thing we could talk about for days. You know, from the developmental issue, but that's a sensory need that you guys are helping with. Yeah,
That's cool. I didn't even know that.
yeah, it's huge. It's called hyposensitivity, and it's a sensory processing issue. And most of your kids and young adults that have developmental issues and autism and things like that, they have sensory issues. And the ones that are going to do well and good candidates for in here are the ones that are hyposensitive to touch and movement. They seek that kind of thing. It's called hyposensitivity.
That makes sense.
Yeah,
For sure.
yeah, and this is perfect therapy if you have a kid that desires that. Yeah,
You see their attitude change, even just simple things like turning up the music.
yeah,
You know, we've not had, and that can probably work on the adverse side of that too, where it's too much, right? It's too
Yes.
much input,
Yep.
and they will shut down. We've
Yeah.
not had that yet.
yeah. You
But-
definitely need to do some good screening.
Yeah, and that's what we
Yeah.
try to do.
Yeah.
When we talk to them.
Yeah.
Really walk them in slow.
Yeah,
you
yeah.
know, Let them stand up here.
Yep.
And you can see it right away.
Yep.
They're either active and let me go,
Yeah.
or they can start to
Yep.
shy away
Yep.
right away.
And you have good conversations with their parents and stuff too.
Yeah,
like-
you get some information. I call that big picture analysis, where you don't just, if you got a person with a developmental issue, you don't know what their diagnosis is. You don't know if they are hyposensitive or hypersensitive. You try to get some big picture information. And if you got a parent or grandparent that says, "Oh, my kid loves to jump on the tramp," they're a good candidate for it here
Yeah,
because they're
that's right.
hyposensitive.
Yeah, that's right.
They desire movement and
Movements.
right, yeah. So that's why I always, whenever I go in and consult with different places, I always say big picture, big picture, big picture. Because if you're, putting someone in that's not a good fit, and all of a sudden they're in the corner, plugging their ears and crying, or enraged, they're hypersensitive to sound,
Yeah.
Right.
and
So
we're
what do you-
actually doing detriment to them. Yeah.
What do you do for someone that's hypersensitive then?
For hypersensitive, we do different things. We offer them sensory soother. You can do things, fidgets that soothe. Colors, like there's some statistical analysis out there that indicates that hypersensitive individuals really soothe well with blue and green hues. So I've coached parents, say, hey, go home and paint one of your walls green, and when he gets all rageful or angry, lay him in front of the green wall, because there's some data out there that says, okay, blue and green hues help with hypersensitivity. So you try to do some things that help soothe those sensory things. Yeah.
So from like a physically active standpoint, I guess, would that be like yoga or something? Would that be good?
Yeah,
Or is
yeah.
that still because they're moving a lot.
Yeah, with a hypersensitive person, we call it mindfulness psychology, where they're doing yoga type things, deep breathing, what we call grounding techniques. Because kids with hypersensitivity, they don't calm. The brainstem calms your heart rate, blood pressure, and breathing. So you got developmental issues, and you don't know how to calm your brainstem, so you never kick in your frontal lobes, which helps to regulate emotion. So you got to teach them how to regulate their brainstem by deep breathing, mindfulness psychology, grounding techniques. And not only developmental individuals, people with developmental issues, but also people with anxiety, depression. A lot of people don't know how to regulate their own heart rate, blood pressure, and breathing.
Yeah.
So you got, and exercise is great for that, because it's a natural
Right.
thing where you're breathing in and out, diaphragmatic breathing in through your nose and out through your mouth.
Check out our last podcast.
Yeah.
Shameless
And diaphragmatic breathing is huge in regards to brainstem regulation. And they regulate that brainstem, they turn on the boss, which is your frontal lobes, which then regulates overactive amygdala in the limbic system. So the whole brain is just interesting, and how exercise, grounding techniques that we use in psychology just helps regulate that brain so it can be more productive, and that in turn helps with gut issues, and it's just amazing. And we just don't understand, lay people don't understand their brain enough to actually regulate it.
Yeah.
Yeah.
That's crazy how much your mental health goes into your physical health, goes into like the brain gut barrier.
Oh, yeah.
Not
Yeah.
barrier, I guess, but
Yeah.
it's crazy. Yeah, how much just like being healthy affects so much more than just your body,
Yeah,
right? It's
yeah.
like
Yeah, if you
all
look
the
at
processes and everything.
Yeah. If you look at brain gut, let's say, for example, there's about 3% of the population that meet criteria for ADHD. So chances are you've had people in here with ADHD, probably because people with ADHD actually get addicted to exercise. So,
I don't know
So-
what you're talking about.
it's one of their positive addictions. Some data out there that says that people with ADHD can really get hyper focused on exercise. So, but the thing about ADHD, for example, is there's a lot of gut issues because there's a correlation with dairy allergies and ADHD. So, you look at even gluten allergies, gluten and dairy allergies, are going to affect our joints. Okay. So whatever toxicity I'm putting in my gut, if I'm allergic to something and I have ADHD, my ADHD symptoms are going to get worse. I'm going to have distractibility. Yeah. So, a lot of times if I have a client come in and they're having gut issues, or I can predict they have gut issues because, they got that diagnosis, and you alleviate that, their body's working better, their brain's working better, joint health, all that stuff is you can predict that with certain diagnoses. Mm-hmm.
That's got to be a positive experience. Everything starts feeling better.
Yeah.
So, I had a question. This is taking it back to like the beginning of the podcast.
Mm-hmm.
But so, like trauma and stuff causes depression, like a lot of trauma. What about would trauma that someone like doesn't necessarily remember? Could that cause some like depression? Like if you like when you're like a little kid.
Yeah.
And then maybe you like just have blocked it out over the years.
That's a great question. Trauma can occur in infancy. Actually, trauma can occur in utero. So I'll give you an example. There's a theory out there called predictive adaptive response. Okay, so an example would be, say mom was, while she was pregnant with baby, was abused by dad or husband. Yeah. And that baby experienced that abuse in utero. That baby can have a higher probability towards anxiety, depression, and ADHD. Okay. Why, we might say? Well, predictive adaptive response says this: if a baby's experiencing trauma in utero, that child is going to be prepared for trauma outside utero. So anxiety triggers hypervigilance. Hypervigilance increases likelihood of survival. So if I'm hypervigilant, I'm going to survive a crisis quicker. Now, here's the thing about hypervigilance. If you have it too long and you have cortisol that's running through your body and brain too long, then that damages you in the long run. But in the short term, you're going to survive.
It's a fight or flight.
Right. Yeah. So
This is all connected.
yes. Yeah. So
It's absurd.
you look at predictive adaptive response, that baby's going to be prepared outside the womb to survive. They found this theory out by studying anorexic women. They found that these anorexic women who were pregnant, who starved themselves, what they found was these babies were born and they grew up to be obese because they were actually prepared for famine, but they were actually had access to food, lots of food, and they overate. So most of the sample that they studied were obese. And the theory was mom starved herself, they were prepared for famine, and they had excess. And impulse control comes from the frontal lobes. Babies don't have frontal lobe development. They overeat, they become obese. That's predictive adaptive response right there.
Wow.
Yeah. That's heavy, right?
Jeez,
No kidding.
especially with like the last 3 podcasts we've had, that just tied to everything.
Yeah.
Yeah, everything that we've talked about started with Dr. Libby Wilson was about the
Or
first thing
increased
she looked at is
cortisol.
let's look at cortisol levels.
Yeah.
Let's look at adrenal fatigue.
Yeah.
Because of the world that we live in today.
Yes.
We're hit constantly.
Right.
We can't get away from activity
Yeah.
in some form or fashion, electronic, works
Yeah.
into this. We're working more
Yeah.
hours.
Yeah, you can work at home now because of
Yeah.
In the
electronics.
history of mankind as we're
Yeah.
kind of thing, right?
We're also having a lot of secondary trauma. Secondary trauma is, I look at the news.
Yeah.
There's shootings, or we go to work and we hear somebody has, a chronic disease. And then we start taking that stuff on, and then we experience secondary trauma, and then we release cortisol.
Yeah.
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 And over time, it just damages.
Yeah.
Yeah.
Fatigue sets in. I think as I just sit and listen, one of the things that I've had to overcome myself from looking at somebody after starting CrossFit and after being in here, and you go to the store and you see somebody in the cart pushing, the electric cart pushing around, and they're obese, and your mindset automatically goes like you've done that to yourself.
Yeah.
But what I'm learning is, okay, so there's a part of it, that possibly you've made the decision to live your life that way.
Yeah.
But there's so many things
Yeah.
that have compounded
Yes.
over, because you didn't wake up tomorrow and you're not 500 pounds. That's
Yeah.
just not the way it works.
Yeah.
Right? But life, and what you're talking about from a depressional perspective, that's compounded.
Yeah.
Time,
Yeah.
over year, over year, over year,
Yes.
to get to that point.
Yeah.
And I've never slowed down enough
Yeah.
to take that mindset and go, oh, geez.
Yeah, that's a great point. And, I'm not a saint by any means for sure, but being a psychology professional has helped me. When I see an obese person pushing around a cart, I think this, man, there's a rad story in there somewhere.
Yeah.
Some sort of story that has triggered all this, and there's some sort of amazing survival story in there. Now, if you sit down with them and you talk to them and ask those open-ended questions, all of a sudden they start telling you all these amazing things that they survived. And then that's when I'm saying, how did you do that?
Yeah.
And then they can start saying, well, I ate, I self-medicated with food, or, they start telling us how they, survived that. And then what I got to do is I have to help them grieve the loss of their friend, which would be self-medication of overindulging. So I got to get them to have compassion enough to grieve that. Now, when we go back to the righting reflex, there's no compassion in that. We just simply say, stop doing this. You're going to kill yourself. Mm-hmm. We never get to that cool story.
Right.
And they won't give us the time of day because they're at Dairy Queen self-medicating right after being shamed by us.
Yeah. In that 15-minute window that you had at the doctor's office, because that's all you get.
Yeah, 15 minutes, yeah,
Right.
yeah.
And in that 15 minutes, you got to make sure you cover yourself in your insurance.
Yeah.
You got to diagnose the patient.
Yeah.
You got to give them the prescription.
Yeah.
You got to tell them stop doing that.
Yeah.
I've got to go on.
Yeah, you have
Yeah.
the patient has like
Yeah.
a 5-minute talk with the doctor, and then
Yeah.
by the time they fill everything out.
And you talk about, is there time for physicians to do this? I have 50 minutes with my clients, 50-minute hours, and I have time to do that. Well, my contention is, yes, you have time. I can design. Yeah, I actually, have gone into companies in different places, and I can give them a form to follow with open-ended questions. I actually have it if you guys are interested in it.
Yep.
Definitely.
Where you can simply go over those, and it can take you 15 minutes. So it's doable. Even in physicians, it's just, I think a lot of it is not a lot of people have heard of motivational interviewing, and it's been around a long time, actually. Yeah.
Yeah, I'd like to talk to Dr. Wilson about that a little bit. I'd love to link you two up, because I think, again, it took her in her 40s to say, this system is broke.
Yeah.
Like, I may be helping people temporarily,
Yeah.
but I am not curing this individual
Right.
of the problems that are underlying.
Yeah.
And she even said that too. She's like, she's helping that, like you said, temporarily, but she always knew that she was going to have clients because they always
Yeah.
were going to come back.
Right,
You're
yeah.
not fixing them or change.
right.
They're not
Yeah.
changing their lifestyle or
Yeah.
anything.
Yeah,
So
that's right.
Yeah, some of my most successful cases is when we've taken a community approach to treatment, where I've got a release to talk to the physician, I've got a release to talk to support people, and we work together at understanding the story, and we're getting to the root,
Yeah.
and we're all treating our own specialty together,
Yeah.
which
and
I
then you
think
got
that's how
people
it should be
flourishing.
anyway.
Yeah, yeah, yep.
Well, and that's exactly the atmosphere that we're trying to create here. It's forget the name on the board for a minute. That's what it's about, is how do we affect the community that we live in, Salina, or wherever you're at? How do we make a positive impact? And that's physically, by being better, and by trying to get better in shape, right? It's how do you eat properly. We've got that ability to give you the cues.
Yeah.
We're not going to shame you. We're just going to show you, here's what we do.
Yeah.
I've got a little knee problem, a movement problem. Great. We've got a physical therapist that can help you with
Yep.
that.
Yeah.
Right? Boy, I've got some chronic things, type 2 diabetes. You know what? we've got a functional medicine doctor.
Yeah.
What I would love to do is say, hey, there's some depression going
Yeah.
on. Because we hear that.
Oh, yeah.
Once they start coming in
Yeah.
here,
Mm-hmm.
you can see it in
Yep.
their face.
Yeah.
The second they walk in, if they're not their normal, happy self,
Yeah.
you're like, whoa, hang on, hey, how's it going?
Yeah.
Oh, man, I got this thing going on at work.
Yeah.
And you're seeing a shadow of what's
Mhm.
really going on, right? Because they're only showing you the shadow. They're
Yep.
only showing you the, I got something going on. And it may be like, hey, this is life ending for me.
Yeah.
I can't take it anymore.
Yeah.
You know what I mean?
Yes.
So I would love to be able to say, hey, let us help you with that mental side.
Yeah.
We can't do that here.
Yeah.
That's not our specialty.
Right.
But we've got doctors on our side.
Yeah.
You should go talk to this individual.
Yeah.
And that's, again, you're developing a central place where it's not just about coming in and throwing a barbell.
Yeah. Yeah.
It's about how do I live better for tomorrow,
Yeah.
so I can be a better person for the people around me,
Yeah. Yeah.
right?
And you're fixing like everyone's problems essentially, right? So everyone has some sort of problem, I think. I think I personally believe that. But they come in and they're like, hey, like my back hurts, I can hardly do anything, and they're like, oh, I'm depressed, and you're just like, oh, you see them. It's like a community where everyone might not be like completely 100% all the time, and that's okay. You can share that with everyone and then get a good workout in and stuff.
Yeah.
And
It's a safe place.
It's a safe place,
There's
yeah.
no mirrors on
Yeah.
the wall.
Yeah.
It's a safe place where you can feel, okay, I can share that because I know that they're going to try to help me get
Yeah.
something
Right.
from a
Yeah.
fashion.
it's like an extended family almost.
Yeah.
It's great.
Yeah.
And the cool thing you guys are starting to do is you're centralizing providers that can get in the different facets,
That's right.
then the mental health, the physical, the chiropractic,
Yeah.
all those are, you're
Yeah.
seeing that.
Mm-hmm.
And that's how, like I said, that's my most successful cases. I'm working together with other partners in the community that have their own specialty, really smart people that are, working their specialty and all sharing together for one common goal is get them to feel better. Yeah.
Yeah.
Uh-huh.
So a question I had, I guess, is Matt was saying, like, when people walk in and you could just tell that they're not all right or they're
Yeah.
just not their usual self, how long, like, that could be just, like, a bad day at work or something,
Yeah.
and tomorrow you're fine, or, like, how long does that take that sadness to turn into depression, and then
Yeah.
that depression to turn into something like, hey, you should get help?
Yeah, that's a good question.
Yeah.
Depression, the definition is 2 weeks or more often than not, feeling hopeless, helpless, loss of interest in things, thoughts of death or suicide, isolation, fatigue, body aching syndromes. 2 weeks or more often than not feeling that way, you meet criteria for major depression. Okay, so 2 weeks or more. Now,
That's not a lot.
no. And you might ask, a lot of times we don't know what to do with that. We can see somebody is not feeling good and not themselves. Well, we kind of, in westernized culture, we just let's keep to ourselves. We got our own goals. But if you got a relationship with them, I like to show them, mirror back what their nonverbals are. I get them I'll get them by themselves. I say, hey, I'm seeing, you're isolating. You don't seem yourself. You look down. What's up? Tell me about it. And more often than not, if it's the right situation, there's the timing of gesture, and it's the right timing, they want to tell you. They want to tell you. You just got to set up the right environment to tell them and be appropriately intrusive enough and have that relationship enough to go there with them.
Right.
And then you can make the referral. Because you can't become the therapist. It's not your specialty.
No.
Right.
Yeah, and they trust you. They've told you some of the story. You refer them to the people that may work for them.
Yeah.
Mm-hmm.
And yeah,
Can truly help.
Right. Yeah.
But there's that saying, and it's not a saying really, but I think it's like if you ask a person how they're doing, then mean it.
Yeah. Yeah.
You
Yeah.
gotta show you
Yeah.
care.
The worst
for
thing you
sure.
can do is ask somebody how they're doing and not mean it.
Yeah.
Yeah, like what's up as you're walking by.
Yeah.
You can,
Yeah.
You, you can sense. I can sense it.
Yeah.
You know, meeting strangers, like, oh, how you doing?
Yeah.
Like, you don't.
Right.
You don't.
Yeah.
I
Yeah.
ask.
Yeah. Yeah.
You're gonna ask.
Yep.
Mean it.
Yep.
Right.
And that's why communicatively, you start with, "Hey, I noticed this,"
Yeah.
so they know you're not just doing that.
That's right.
You know, because that's we do that in Walmart. I purposely don't ask how you're doing back, not to be rude, because I really don't want to talk right now. I just want to get, my stuff.
Yeah.
So there's a time and place, and if you set it up right and you say, "Hey, I'm noticing this. Tell me about it."
Yeah.
More often than not, if you got a relationship with them, they're going to tell you. Yeah.
I think it's interesting. You say like just walking by someone in Walmart, just like, "Oh, how you doing,
Yeah.
brother?" You don't say it back.
Yeah.
But then sometimes I'll be just waiting in the checkout line and be like, "Hey man, like, how's it going? Like,
Yeah.
how's life?" And then you just like, you have like their whole life story
Yeah.
in that 5 minutes while you're waiting
Yeah.
in the checkout
Yeah.
line.
Yeah.
It's kind of cool.
Yeah, well, psychologically, if you want me to touch on that, there's a whole other story for that.
Yeah.
I don't know if you guys want me to go there or not.
Sure.
I'm willing to hear. Yeah.
When you go to some place and you say how you doing, you get their whole life story, that's a sign of lack of boundaries. They don't know you and you're telling their life stories, and that can come from a lot of different things. An example would be, let's say you were sexually traumatized as a child, okay? So you're taught that there's no boundaries, okay? You got zero boundaries. Because everybody has invaded your space, and they've abused you. So they've learned in life they have no boundaries. So you're a stranger. You ask me how I'm going to do. I have no boundaries. I'm going to tell you everything.
Right.
And I have a lot of compassion for individuals that do that, because I know that there's a lot of trauma behind that.
Severe trauma.
Severe.
That's crazy.
Yeah.
I
Yeah.
had no idea. I was just like, "Oh, what a good conversation."
Yeah, and a lot of, and not every time. So I'm not
Right.
judging people who are that do that, but a lot of times,
Yeah.
it's a sign that there's a lot of pain in there, and they just don't understand boundaries. And if you look at trauma, there's some studies out there that indicate that 40+% of men and women have experienced or witnessed trauma. Some will develop PTSD, post-traumatic stress disorder. Some won't. Over 40+% of men and women.
What defines trauma?
Well, there's physical trauma, there's sexual trauma, there's emotional trauma, there's all three. What we call polyvictimization is where you have trauma stacked on top of. Polyvictimization is the worst, where you have all facets of trauma and it's long lasting. So those are your individuals that don't have boundaries. But then you got other individuals that are so guarded, they don't tell you anything. So it can go either way. You got the individuals that are so tight, they're not telling you anything. That can lead into other psychological conditions that we don't have time to mention now. But it can go either way. Too loose boundaries or really rigid boundaries.
Go ahead.
Do you see that in different kinds of trauma elicit like a different response?
Yeah, sexual trauma is the worst on people. It's like being injected venom.
Right. That completely makes sense. But
Yeah.
I guess what I was wondering was like I don't know how to put it. If like in terms of like closing up or saying everything,
Yeah.
does the sexual trauma probably closes up a lot more?
Not necessarily. It all depends on the person.
Okay.
Sometimes you'll get stories where whoever abused them said that if they told anyone, they would wipe out their whole
Right,
family.
yeah.
That's so they've been conditioned to not say a word.
Right.
And
That's terrible.
Yeah,
Ugh.
and then sometimes you got to spend, clinically, you spend years with that person developing that trust.
Yeah.
You're finally in the in group,
Yeah.
and they finally tell you. And the thing about trauma is, if it's not exposed, it has power over you.
Yeah.
Yep. Yeah.
One thing I want you to, for my knowledge, so our listening public has the same knowledge as well. PTSD, we kind of relate that anymore to war veterans coming back, right?
Yeah.
But PTSD is so much broader
Yes.
than an individual that's been in war.
Yeah.
You kind of hear that in
Yeah.
the news.
Yeah.
Right? That's that hot topic, hot button,
Yeah.
buzzword.
Yeah.
But it's so much broader than that.
Yeah.
Is that correct?
Yeah. Post-traumatic stress disorder. Yeah. If you have experienced intense, life-threatening situations, or you've witnessed that, you're a candidate to experience PTSD. And 6+ months where you have symptoms of hypervigilance and nightmares and flashbacks and traumatic memories, those are symptoms that you would experience with PTSD. Now, we're also, if you think about this from a relational perspective, we're also finding that people who've been betrayed by husbands, wives, partners, they're experiencing PTSD-like symptoms just from being betrayed by their partner.
Yeah, loved ones.
Yeah. So they got a PTSD type of symptoms.
Yeah.
So, it's just not war veterans.
Makes
Yeah.
sense.
Although, I have compassion for anybody who experiences
Yeah.
PTSD.
Yeah,
Mhm.
for sure. Definitely. Man, I've learned a ton.
Yeah, this is
Ton.
good.
Yeah, a ton. And I think there's so much, and I think there's so much follow-up that we could do, breaking into individual facets of just going back to how do you approach someone that needs the physical help that helps their mental problem. How do we bridge that gap?
Yeah.
I would love to dive into future things on different conversations, future podcasts about
Yeah.
breaking down those gaps.
Yeah. This was kind of flowing all over the place, wasn't it, today?
Yeah,
Yeah,
well, I mean, this is exactly that's why we wanted to bring you on. Right?
Yeah.
There's such a tie to that mental part of your well-being
Yeah.
that is affected by just physically moving a little bit more than what you did yesterday.
Yep.
Right?
Yeah.
And that endorphin rush of,
Yeah.
I've accomplished something.
Right. Yeah.
Even if it's just setting up and setting back down 10 times.
Yeah.
That's it.
Yep.
Sit on our couch, stand up, do that 10 times.
Yeah.
That's all we want you
Yeah.
to do.
Yeah, the same thing with, you look at neurochemistry and movement. You say, an addict who has depleted their dopamine reservoir, and they need to learn how to naturally release those reward centers in their brain. We got to start them, we find them a community,
Right.
we start getting them movement, and we let them start experiencing natural highs that they were getting, through their addiction unnaturally.
Right.
Yeah.
Yeah.
So, you guys, we were talking about the
Yeah.
different places that are starting
Exactly.
to employ CrossFit into their addiction recovery
That's
and,
right.
and all that.
Yeah, we definitely want to dive into that deeper. I think there's ties to simple things like alcoholism and obesity after alcoholism. So if
Yeah.
I'm going to AA, right, and I've recognized I've got a problem, a lot of those patients fall into obesity
Yeah.
because they replace that alcohol with
Yeah,
sugar.
right. Yeah.
It's that
Yeah.
sugar that ties those two things
Yeah.
together, and all of a sudden, they're not alcoholics anymore.
Yeah.
But they're obese, they're
Yeah.
type 2
Yeah.
diabetics
Yeah.
because they've replaced one
Yeah.
dependency
Yeah.
for another.
Let me hit that a little more specifically. Okay, so let's say you're a beer alcoholic. Beer has high carbohydrates, right? So what happens is when you become addicted to alcohol, your body needs it to feel normal. So if you look at that from the body's perspective, you take a person that wants to get recovery, so they go to bed, pass out, and then they get up in the morning, so their sugar and carbohydrate level is really high. They wake up in the morning at a crashing sugar low, and now they got to do something to boost their sugar up again to feel normal. They have the shakes and so they drink the alcohol in the morning, the hair of the dog,
Yeah.
to regulate their sugar. So you got a physiological thing they're medicating because they feel really bad. They have the shakes, they're at what we call delirium tremens. And now I've got to boost up my sugar. I know how to do that quick. I'll grab the hair of the dog or the beer the next day.
Yeah.
So,
Yeah. And
Yeah.
mentally,
Terrible
they're
cycle.
not relating the sugar part of it. They're
right,
relating,
right,
I
yeah.
know if I drink that,
Yeah.
it's gonna make
I'm
me
gonna
feel
feel
Right.
so
good.
much better.
Yeah, they don't know what's happening.
That's right.
Yeah. So that's why we do education with recovering people.
Yeah.
And then, they have the depletion in the dopamine, the sugar issue.
Yeah.
I go to AA or wherever,
Yeah.
and here I've got access to donuts and coffee and, a stimulant in the sugar.
What's there.
Yeah,
That's
right.
Yeah.
So we're not, a lot of times, and we're getting better. A lot of times we're going into really great places, like AA and recovery places. We're making some bad choices while we're there that decreases the probability of success in your recovery.
Yeah.
Yeah.
Yeah. Or we're changing that dependency from one to another.
Right, yeah.
You know, although it's perceived as healthy.
Yeah.
Because I'm not diving into the alcohol but yeah, physically we're probably not doing the best we could.
Right, yeah.
You know, kind of,
Yeah, yeah.
Yeah, there's so much we could talk about.
Yeah.
Super excited. This is good. This is good. Did you have any questions you wanted?
I have like 5. So maybe shotgun answers. Just real fast.
Okay. All right. We'll shotgun some answers and then close it down.
That's right. Yeah, we'll shotgun answers and close it down. And
Yeah.
I'd love to have you back.
And then come-
Yeah, I enjoyed my time. I appreciate you guys having me.
Yeah, I think there's so much that our community's gonna be like, wow. Yeah,
There was so much that I was like, wow.
Yeah, there's
Especially with the other podcasts that you just like tied it all in. I was just like,
yeah.
Good. I'm glad it.
didn't even try to do that and it
Yeah.
worked.
Yeah, that's
Matt
right.
didn't even make an outline today. Whoops. Okay. Question 1. What's a few things every day that you do to positively impact your health?
You're talking about me personally.
You personally.
I get up at roughly 5 a.m. every morning, and I have my own personal gym with a buddy of mine, and I religiously go in every day. Anybody knows not to call me or bother me. That is my time, and as a person that provides a service, I really, really protect that. So an hour, I start my day out. I fast all the way up to my workout, roughly 7 p.m. to 5. And then I get my workout in. I'm done with my workout around 6:30. So my kids and my wife don't even know I'm gone. But I get a combination of weight training and cardiovascular work in, circuit training. I idolized Arnold Schwarzenegger, so I do more of the traditional bodybuilding, circuit training. But I love all kinds of exercise. I move. I have to move. If I didn't, I know with my background of trauma and my own, predisposition for psychological issues, I'd probably be taking medications. Nothing against medications. My motto is God made doctors to make medicine to help people. So I'm not, but for me, I get my dopamine through my workout.
Yep.
And, trying to eat the right things, I think you're keto. I'm not that disciplined. With that being said, I'm pretty regimented in what I eat. So I try to eat the right things. I try to educate myself about what's good for me. I've identified certain allergies in my life that were negatively impacting my joints, alleviated that. So my joint health is tremendously better. I work out every morning with community. I have 2 brothers, not my biological brothers, but my brothers in Christ that I work out with every day. So I get a sense of community. We razz one another at times for fun, and then we open up and talk about serious things. If we're on the treadmill or doing cardiovascular work. So it's community. I believe in that community workout approach, and it's done amazing things for me. I've always struggled with my self-worth. So shaping my body, and I'd love it to be, more in shape than what I am, but shaping my body as a 46 now, are we 46? As a 46-year-old man, it just makes up for some of that lack of confidence that I've always had, that I probably always will have. It gives me just a little something, and then I take it to the spiritual level, God made my body a temple that houses the Holy Spirit. He wants me to take care of it. So I remember that, and I try to take care of what He's given me the best I can. And if I see somebody that's not, at work, I try to get to their story so I can help them, and not shame them, but help them through that. So that leads me to another thing I do is I serve. I try to serve. Because there's sometimes I wonder, okay, am I getting more out of serving because these wonderful stories I hear, or are they getting more from me?
Yeah.
So those are just a few things I do.
All right, that was a hell of an answer.
It wasn't a shotgun enough, I don't
It's not a
think.
shotgun, but I liked it. All right, what's one thing you know you should do to positively impact your health, but you don't?
That's a really good question. I don't open up enough about my own emotionality. There's something called alexithymia. Alexithymia is where we don't identify, express, and regulate our own emotion. I'm so busy with others that I isolate people from my own emotionality. And when I do, it's not good. I isolate, I'm irritable. My wife says, okay, we need you back. Mine is flat out alexithymia response from my own emotions. I just got to share. One of my favorite scripture verses is the shortest scripture verse in the Bible. Jesus wept. And as guys, we're taught not to feel, right? Where we have three feelings and they're all the same: angry, mad, and pissed off. And he told me to weep and get down to the inner feelings that matter. Mm-hmm. And then when I share them, and I don't trust very easily, so there's only a few I share with, it just regulates me better. So sharing emotion is one thing I got to work on.
Nice. That's probably hard as a psychologist.
It's difficult. Yeah.
All right. What's advice you would give to someone thinking about your career? Like maybe with like schooling or with how to get.
Yeah. I took the long road. I'm not actually a psychologist. Like I said, I have a PhD in general psychology. I took the long road, kind of a hard road. I was lost until my mid-20s. Call it ornery, lost, whatever. Just trauma and my own trying to maneuver life. So I started out in psychology because it was helping me. So I got my bachelor's. I got in the field of addiction, not really having my stuff figured out yet. Figured my stuff out while that was going on. And then I was encouraged to get a master's degree. And from there, I didn't want to stop, so I got a PhD in psychology. But that was the long road. So most people in my field, they have some sort of trauma and a longing to serve. And I'm just going to say, it doesn't matter what your story is, you can do it. Mm-hmm. And if you're passionate about serving others, talk to somebody in the field to help guide you in regards to, how to manage it educationally. I could have used a little more guidance in that area. Mm-hmm. Yeah.
Nice.
Excuse me.
All right. So next one, it can be, these are the last. I'm just going to combine the last two. A couple good things to do each day for your mental health, and like one or two good books.
Yeah.
It doesn't have to be psychology related books. Just
those are the only ones I read.
That's exactly what that would
be. You said what was the first part of that?
A couple good things to do every day for mental health. Maybe not every day, but often. Or
some people might turn them off when I say this, but I know what I do is I read God's word. It soothes me. It gives me wisdom. It gives me encouragement. I start most of my days in the Bible. After my workout, that is. So that's a major thing I do.
Nice.
Yeah, and then books. One that is a must-read. For rural Ohio, it's called Running on Empty. It's actually where I get my term alexithymia from. It talks about especially in rural communities. It's not all rural communities, but we're conditioned in small communities to not feel. Okay, suck it up. Don't feel, conceal your feelings. And there's repercussions to that. We don't know how to love, give and receive love. We don't know how to regulate. So we're in a community, German Catholics that don't know how to feel or regulate or validate feelings in others. Do I have time for a quick story?
Yeah, absolutely.
A prime example of that would be, you're a little kid and you hate condiments on your hamburger, okay? and you drive through the drive-through with your parents, and they order a hamburger, and the hamburger comes back with all these condiments on it. And the child doesn't complain because they know if they do, they're going to get yelled at. Okay? That's the way we're conditioned to not feel. Okay? In a real world, we'd be able to drive through and they say, hey, Mom, Dad, thanks for the burger. I'm really upset because I have, these condiments on it. And Mom and Dad would say, oh, man, that stinks. That's really frustrating. They always get that wrong. What do you want to do about that? Well, we're in a hurry. I'll just eat your French fries. Probably not a good example being that we're at CrossFit. Yeah.
Okay, though. It's a great.
That'd be an example of, a simple example of generational alexithymia. We're not allowed to feel. We're not validated for our feelings.
Yep.
And what did I say earlier about validation? It regulates the overactive amygdala, was where anger and anxiety live. So if we learn in rural communities just how to validate one another,
Yeah.
we got more regulated amygdalas. Yeah.
I think I do that. That's like a weird thing. My mom is from like the city, like
Yeah.
in Grand Rapids.
Yeah.
And she will, like, if she gets food that she doesn't like, she will tell, like, hey, this isn't what I ordered.
Yeah.
And me and my dad and brother were just like just eat it. Like,
Yeah.
why would we?
Yeah.
Why would
Yeah.
we say anything about it?
So the next time your mom's upset, you say, Mom, that's really frustrating. You ordered what you ordered and you didn't get it. So now you're working against alexithymia.
That hits home. And I'm just shocked that we're continuing a little bit here that you shared that, because that hit home. For me personally, I went through an extremely traumatic event when
Yeah.
I was young.
Yeah.
That I remember as clearly as it happened
Yeah.
yesterday.
Yeah.
But I can count on one hand the individuals that I've shared that with.
Yeah. Yeah.
And that's maybe one or two. And
Yeah.
one of those was a counselor that I was taken to when I was 10 years old
Yeah.
to talk about it.
Yeah.
And I didn't talk about it then.
Right.
That
Yeah.
individual.
Yeah.
I didn't want to speak
Right.
to a stranger.
Yeah. Yeah.
You know what I mean?
Yeah.
But we're so conditioned.
Yep.
And that's the honest to God truth.
Yeah.
Even with my family,
Yeah.
I've not ever been
Yep.
asked,
Yeah.
hey, what happened that day?
Yeah.
How do you feel? Never once.
Yep.
Never once.
Yep.
So,
That's generational. That
Yeah.
we don't unpack those emotions, conceal them, don't get them out.
and it's
Yeah.
not because it's not because they didn't care.
Right. Yeah. You just didn't know how.
Yeah.
Yeah. That's not, when I say that generational, it's not an assassination.
That hit home. Yeah.
Right. It's not assassination of characters who we brought up. That's the way it always has been.
Yeah.
So if we can work against that, and that'll help us in here too, in the gym.
Yeah.
You're just being able to validate one another. It's just huge benefit to that. We don't know how to do it.
That's odd
Yeah.
that you said that, because when you were talking about that, I was like, oh, I wonder what happened. I should ask him what happened. And then you said, I've only told 2 people about it or whatever.
Yeah.
And I was like, oh, no. Like,
Yeah, yeah.
I don't want to budge into his
Yeah.
stuff, you know?
Right. Yeah.
Literally, I have
Yeah.
the problem.
Yeah. My saying I said earlier, appropriately intrusive.
Yeah.
You know?
Because, like,
Yeah.
I care. Like, I care a lot
Yeah.
about Matt. I want to, like, know.
Yeah.
Or, like, help, you know?
Yeah.
But
Yeah.
I closed up.
Yeah.
You know where I feel the calmest when asked and sharing that is in front of those juveniles.
Yeah. Isn't that amazing?
If a stranger came in,
Yeah.
or even an adult that I
Yeah.
know well came in and was
Yeah.
like, hey, tell me about that. I'm like,
Yeah.
maybe sometime.
You just-
but if
yeah.
one of those kids,
Yeah.
had that, I would talk to them
Yeah.
about it in a second.
That's because they're in the in group.
Yeah.
They experience some
Oh.
similar stuff, just like you're talking.
Yeah.
The in group right there.
Right.
Yeah. Powerful.
I feel like I should pay him.
Psychological research. This is crazy.
Yeah.
I'll pay him too.
I'm not opposed to taking money either.
Yeah, how do you do that? He came here to make money.
Well, this has been great, man.
Yeah.
I really appreciate it.
Thanks for having me. I'm glad you guys are doing this. This is phenomenal. Hopefully, a lot of people get exposed to these podcasts, and it helps. Yeah.
That's our goal.
Yeah.
Well, man, I love you. I appreciate you.
Back at you,
Yeah,
man.
thanks a
Yeah.
lot.
We'll have you on again and go from there.
Okay.
CJ?
Boom. Dave, thanks, Dave.
Yeah, thanks, Dave. Yeah.
Couldn't drink though too because we're not sponsored yet and ran out, but it's fine.
All right. Thanks, guys.